Disclaimer, friends, my videos has informations only. Please consult your teacher or an expert. To get a feel of a disabled person sit in a wheelchair for some hours as paraplegics spend 15 to 16 hours in a wheelchair in a day and probably for rest of their life. See, I am sitting in a simple wheelchair. This is a plastic chair and this is a wheel here. Friends, today I am going to talk about rehabilitation medicine. This video is basically for physio rehab professionals, but as per the content of this video at the end, it suggests that it should be viewed by medicos and common men and women as well. Rehab word is also used by many other programs like rehab of the drug and alcoholic addict persons. Rehab medicine has 4 dimensions: IBR, institutional based rehabilitation, where disabled person get physio rehab services in the hospital and in the outpatient clinic. The drawback of this program is the remotely residing disabled are deprived. OBR, outreach based rehabilitation, physio rehab professional reach out to the remote places where there are disabled. They give guidance and basic services. It's like a camp. CBR, community based rehabilitation. There are many unfortunate disabled. They have to live their rest of the life with disability and they require maintenance dose. The professionals will give guidance and they are being supervised what to do and what not to do. From them, certain paraplegics require gentle, passive range of motion, turning, etc. that will be taken care by the local group, the friends and family. In CBR, there is a grouping program also. All disabled make a group, and this technology era is very easy. They discuss out their problem and find out their solutions and resources from within the community. In my video, I have shown 7-8 paraplegics sitting on a wooden wheelchair. Good, because if there is a problem, breakage, they can repair it because they have prepared it. If there is a small part missing in a modern wheelchair, unless that part comes from the city, they are disabled again. The 4th era or dimension is CAHD, Community Approach to Handicap in Development. In 2001, there was a huge earthquake in Bhuj, Kutch, Gujarat, and there were many disabled with paraplegics. And they required lots of medical and physio rehab services. Government of Gujarat took a lead role. Plus, Dr. Ali and his team from Nanavati Hospital, they were probably the first people for the therapy part. And there were many voluntary organizations who also rushed in, like Handicap International, and they provided financial services, professional services by hiring physiotherapists, and basic needs of food, shelter, medicine, etc. And this was provided by all the people who were involved, government and voluntary organizations. Government of India sanctioned one ultra-modern hospital building with around 300 crore rupees, which is earthquake proof. I have visited that hospital. I have also gone during earthquake time for 5-6 hour times, and we have also posted physiotherapists there. Handicap International and other voluntary organizations, they observed that in developing countries only 2% disabled are getting benefits given by government and the voluntary organizations. So they have developed this CAHD program with the help or as a team with government, world level organizations and voluntary organizations. CAHD is the fourth dimension. The first three were vertical, whereas this fourth one they prepared that it should go horizontally, around and in the community. The people in the community should be given awareness about a disability. They should be given training and teaching how to handle the disabled person, and to also have an helping hand attitude to help the disabled person, and not just a sympathy of poor patient. God has punished him. No, it's not good. So friends, the CAHD program was first thought by the voluntary organizations, disaster donors. Thank you. My dear friends and families, you can see my videos without cost, no money. Please like, share and press subscribe and bell button. No money. My dear physio rehab and medico professionals plus common men and women, I will be giving information about rehab medicine. Re means again and habilitation means to dwell or to live, means try to live again previous life. Rehab word is used for other programs also. Rehab of drug or alcohol addicts persons, patients due to disease or damage, that is trauma. After the medical and surgical treatment, for some or for many patients, the treatment is not over. The physical or psychological problems are still lingering. They will need physio rehab to restore, regain and to resettle the person to its maximum available possibility. Impairment, abnormalities in body structure and function. Disability, impairment leads inability of mobility, dexterity, use of hands and fingers, stamina, vision, hearing, walking, talking and doing activities. Impairment is physical or mental condition, whereas disability is an at activity level. Handicap, not able to do functions due to social or structural obstacles. For an example, a wheelchair-bound person is handicapped to first floor if there is no lift. Impairment or disability need not become handicap. For an example, a paraplegic, both legs paralyzed, need not be handicapped in mobility as wheelchair is the mobility aid. A deaf is not handicapped with hearing aid. Thank you. There are 4 dimensions of rehab medicine. Physio quiz in minutes. 1. IBR, Institutional Based Rehabilitation. Disabled person get services within hospital or in OPD, outpatient department, or in a specialized center. But here, remotely placed person is deprived of rehabilitation services. B. OBR, outreach based rehabilitation. Physio reach out to remote area. They give guidance plus basic services like it is done in camp. CBR, community based rehabilitation. What is CBR? CBR is a primary health care initiative and comprehensive social model for addressing rehabilitation care in the community setting. It emphasizes community participation, empowering the community to direct their own rehabilitation care, reinforcing human rights of persons with disability, and using existing community resources. Disabled in the community get gathered, finding out their needs from the community itself and using community resources. See in the picture, local made wooden wheelchair also get frequent guidance from the professional. This local made wooden wheelchairs. CBR has 1. Inclusion and participation. 2. Local resources utilization. 3. Empowering the patient and family. 4. Long-term sustainable solution. Now this is the fourth dimension. D. CAHD, Community Approach to Disabled in Development. After 2001, on 26th of January, Bhuj earthquake took place, and it is during that time this CAHD is developed by Handicap International, which gave major help in Kutch earthquake, plus CBM and Center for Disability. CAHD is an extension of CBR because only 2% disabled got services in developing countries through CBR. So CAHD was developed by donors. What is CAHD? Stages of treatment. Number 1, medical treatment. Number 2, formal rehabilitation services in the hospital or in the clinic. Number 3, CBR in the community. And this fourth one is CAHD. Disabled have many difficulties in actual social life as many do not know about disability and their problem. So disaster donors develop CAHD with vertical rehab services going from above down. Horizontal rehab was needed to integrate the disabled in the society for doing day-to-day life. Number 1 was social awareness about disability. This is Disability Awareness Month, March. And these are disability 32 icons. Number 2, understanding disability through lectures. The disabled person is giving lectures about their problems to the normal persons. Know me for my abilities, not my disabilities. We should see that he is having such and such abilities, and we should not also comment like he is a poor guy, he has this problem, that problem. That is sympathy, but it is not needed. Helping hand attitude by common men to disabled. These three aspects are the concept of CA. Active role with a team. Professor Dr. Prabhakar, Superintendent Civil Hospital, Ahmedabad, Handicap International, Headquarter, Lyon, France. Param Pujya Pramukh Swami Maharaj, Babs Swaminarayan. Professor Dr. Ali Irani, physiotherapist, Nanavati Hospital and team. There were many. Sorry, I did not include.